Welcome to This Explainer. Let's just jump right in. If you're tuning in today, there's a good chance you, or maybe someone you know, was recently in a car accident and is now dealing with the incredibly frustrating and honestly sometimes frightening reality of back pain. Well, today we're diving straight into the clinical data to break down exactly why your back hurts after a crash. But more importantly, we're going to map out a clear, actionable road to recovery based on proven conservative care strategies. So let's start by addressing a really common and pretty scary reality that catches a lot of people off guard. You know that feeling where you walk away from a fender bender feeling fine, only to wake up 2 days later in agony? That is completely normal. Back pain very often appears 24 to 72 hours after the fact. See, during a crash, your body is absolutely flooded with adrenaline. And adrenaline is so powerful, it can literally mask the pain of severe bone fractures, let alone soft tissue injuries. It's only as that adrenaline wears off and your body's inflammatory response builds up over the next couple of days that the pain actually sets in. So a delayed onset doesn't mean your injury is minor. It's just the natural timeline of inflammation. To make sure we get you totally up to speed, here is our roadmap for today's explainer. We'll cover the hidden impact, decoding your symptoms, when to seek help, pathways to recovery, and finally, avoiding common mistakes. Let's kick things off with Section 1. The hidden impact. A lot of people think you have to be in a high-speed wreck to get hurt, right? Actually, think again. Even at a crawl of just 5 to 10 miles per hour, your vehicle stopping suddenly transmits a massive amount of G-force straight through your seat and your seatbelt. Because your lower body is strapped down and locked in place, your lower spine, the lumbar spine, essentially acts as a hinge, taking the absolute brunt of that sudden force. This can easily overstretch muscles, compress spinal discs, and inflame those tiny spinal joints. And that sudden whipping force leads us to our first really common injury, the lumbar strain or sprain. This happens when the muscles and ligaments in your lower back get overstretched, causing all these little micro tears. If you're dealing with this right now, you're probably feeling a very localized, achy pain, definitely some stiffness, and maybe even intense muscle spasms. The key identifier here is that the pain usually stays put right there in your lower back. The good news, the data shows most people with these strains improve within 2 to 4 weeks with conservative care. But what if the force was a bit more compressive? Well, that brings us to herniated or bulging discs. The impact of a crash can literally push the soft inner material of your spinal discs outward, and that bulge can press right on nearby nerves. This feels completely different from a muscle strain. Instead of just a localized ache, you'll likely feel a sharp, shooting pain radiating down into your buttock or your leg, often with numbness, tingling, or weakness. You'll probably also notice that sitting down or bending forward makes this specific pain a whole lot worse. Another really distinct injury that pops up in our source material is the facet joint injury. Facet joints are those small, interlocking joints right at the back of your spine. The aggressive, whiplash-like motion of a car crash can severely inflame them. Now, unlike a disc injury where bending forward hurts, a facet joint injury usually causes sharp pain when you extend or lean backward. Understanding these little mechanical triggers is exactly how specialists figure out what's really going wrong inside your back. Moving on to Section 2, decoding your symptoms. Okay, knowing the difference between a totally expected symptom and an absolute emergency is absolutely crucial here. Things like localized tenderness, morning stiffness, and even those really intense locked-up muscle spasms, those are considered standard symptoms of strains and joint irritation. However, you must go to the emergency room immediately if you hit any red flags. We're talking about loss of bladder or bowel control, progressive weakness in your legs, numbness in the groin area, or just severe unrelenting pain. Those are serious warning signs of potential spinal cord or severe nerve compression, and you need urgent medical help. That brings us to Section 3, when to seek help. Assuming you don't have any of those emergency red flags, your golden number is 14 days. The clinical guidelines strongly recommend getting a formal evaluation within 2 weeks of your crash. Why? Well, first off, early assessment rules out hidden problems. But secondly, and this is a big one, in states like Michigan, establishing this timeline is critical if you ever plan to use auto insurance benefits. Getting in early officially documents your injuries and gets a recovery plan in motion way before you develop bad, compensatory movement habits that just cause secondary issues later on. Now, when you do go for that evaluation, here's what you should expect. Your doctor will focus heavily on your injury history and do a physical exam to check your range of motion, reflexes, and strength. And listen closely to this part. Do not be surprised or alarmed if your doctor doesn't order an MRI or X-ray right out of the gate. According to clinical guidelines, imaging is actually reserved for those red flag scenarios we just talked about, or if your pain drags on past 4 to 6 weeks. The vast majority of uncomplicated cases are diagnosed clinically and treated conservatively first.
Which perfectly cues up Section 4, Pathways to Recovery.
In the immediate aftermath, those critical first 48 to 72 hours, your first step is what we call relative rest. This means avoid heavy lifting and high-impact stuff, but whatever you do, do not just stay in bed. Step 2, ice the area for 15 to 20 minutes every 2 to 3 hours for the first 2 days to kill that inflammation. Only switch to heat after that to relax the muscles. And step 3 is gentle mobility. Short, frequent little walks keep your circulation going and prevent your back muscles from completely locking up to protect the injured area. As you move into the professional care phase, the evidence strongly supports a multimodal approach, basically combining a few different therapies. Chiropractic adjustments target joint restrictions to get you moving normally again. Physical therapy is fantastic for core stabilization and building strength back up. Medications can definitely be used under doctor supervision for those severe, unmanageable spasms. And for really stubborn nerve pain, epidural injections can step in to reduce inflammation. Notice what's at the very bottom of the list? Surgery. It's incredibly rare and really only for severe cases that fail weeks and weeks of this conservative care. To highlight just how much timing matters, the source data points out that starting physical or chiropractic care within the first 1 to 2 weeks is a huge advantage. Early soft tissue therapy and joint mobilization calm down those irritated muscles and restore movement to stiff areas like your SI joint or the facets. By addressing these restrictions early, you're essentially sending a signal to your brain that it's safe to stop those painful protective muscle spasms, which seriously speeds up your body's natural healing process. And finally, Section 5, avoiding common mistakes. These are the pitfalls that can literally turn a temporary injury into a chronic nightmare. The absolute biggest mistake? Prolonged bed rest. Get this, staying in bed for more than a day or two actually causes your supporting muscles to weaken and atrophy in just a matter of days, which dramatically increases your stiffness. Also, do not ignore nerve symptoms like leg weakness, and please don't rely solely on painkillers. Medication might mask the pain temporarily, but it does absolutely nothing to restore the motion or tissue strength you need for true healing. You have to combine pain relief with movement-based care. Setting the right expectations is honestly half the mental battle. Healing takes time. Most soft tissue strains and facet joint irritations are going to show steady improvement within 2 to 4 weeks. Now, if your pain flatlines or gets worse around the 4 to 6 week mark, that is exactly when you go back for a reevaluation and maybe finally get that imaging done. For disc-related injuries where nerves are involved, that timeline stretches out to about 6 to 12 weeks. You're going to have good days and bad days, but consistent, gentle movement will keep you trending in the right direction. So we end on the question that is probably weighing heaviest on your mind right now. Will this pain become chronic? The honest answer from the clinical data is yes, it absolutely can. If it's ignored, if you stay completely immobile for too long, or if you just try to mask it with pills. But the really empowering takeaway here is that by taking proactive steps today, by getting a proper diagnosis early, and embracing a structured movement plan, you can protect your spine. You hold the power to reclaim your active life. So my final question to you is this. Are you going to let a momentary crash dictate your long-term health, or are you ready to take the wheel on your own recovery starting today? Thanks so much for joining me for this explainer, and stay proactive out there.